Speech and language therapists don't just work on gender expression. They may work with a client on aspects including self-esteem, managing stress and anxiety, social communication skills, functional communication, and entering new social groups. These are so important as they help the person to participate in their community and improve their well-being and quality of life. The pitch of your voice is how high or low it sounds. Some people have higher pitch and some people have lower. Speech and language therapists work with clients to raise or lower the pitch to a state that they both feel is appropriate and represents the client. Many people on testosterone will find that their voice lowers sufficiently as a result. However, as pitch is only one of the aspects that indicates a person's gender identity, many people on testosterone would attend voice and communication therapy to work on other aspects too. Resonance is how listeners predict the speaker's age, height, gender, and other social factors. A person's voice can resonate in the chest or the front of the face. The therapist and client would practice using exercises to move the resonance of the voice so that it reflects the client accurately. Loudness is created by having more air supply from the lungs and more pressure pushing on your vocal folds when you speak. If someone has a louder voice, they are using more pressure and air supply. Some people use loudness as a way of stressing a word or a phrase. The therapist and client would work on exercises that train the client to vary their loudness and possibly to use loudness as a way of emphasizing. Intonation patterns are used to convey our attitudes and emotions to the listener. We do this by changing our pitch. Some people use more upward intonation patterns and more intonation and inflections overall to highlight and stress their words, whereas some people's communication is more monotone in comparison. Therapist and client will adjust intonation to accurately represent the client. Different people's communication patterns tend to have different rates of speech. In other words, faster or slower speech. The therapist and client would work together to find the most suitable rate of speech to represent the client. Body language makes up 55% of how we communicate. Some people use a lot of gesturing, some people may like to cross their arms, and some may stand more upright than others. Body language and facial expressions vary depending on how the communicator is feeling. So the therapist and client would work on making micro adjustments to the body language, posture, and facial expression to convey different emotions through exercises such as mindfulness. You may not think it, but reflexive vocal behaviors such as coughing and laughing can reveal a lot about the person. The therapist and client will make adjustments to this aspect if the client wishes to do so.